Good evening, good afternoon, and good morning. This is the 1063rd day of continuous uninterrupted webinar by International Forum for Promoting Homeopathy. Today, our guest is Dr. R. Valavan from Wilmashabi, India. He has completed his MD homeopathy in homeopathy and then MBA, and he is a PhD scholar. He is working presently as the head of the Department of Scientific and Medical Affairs at Shawe, India, by the Indian Army of Dr. Wilmashabi Group of Kabul, Germany. Current job profile, he is doing new product development, regulatory affairs, and licensing, scientific and medical marketing, etc., drug proving, preclinical research, clinical research, literature reviews in the area like neuro, psychiatry, trichasy, as well as crystallization and high dilution and phytometric, etc. Presented papers around 50 national and international forums, including Germany, UAE, and Brazil. And he has authored 3 books and edited 2 medical bulletins, and he has published about 300 articles in various papers and contributed many things to homeopathy. And he has been practicing for the last 22 years. And today's subject is clinical utility of rare and clinically established mother tinctures. Welcome, Doctor.
Thank you so much, sir. Very good evening to all. My topic is a little different. Generally, we in most of the webinars and seminars, even conferences, we talk much about single remedy, single dose, classical homeopathy. But this is about mother tincture. So before going to the actual session, let me give you some facts about mother tinctures. Actually, mother tinctures are not exactly the crude extract of drug material. It is actually 1x. It is a 1x potency, but it is not potentized. But the drug strength would be 1/10. And as per HPI, as per HPVS, it is 1x potency. And they are made as per the very specific defined pharmaceutical technique, which is unique to homeopathy. Unlike allopathy, in allopathy actually they take only one particular constituent. For example, it is Nux vomica, then they take only strychnine and they make the medicine. But in homeopathy, the totality of the constituent is very much important. Like we take the totality of the symptoms, and in mother tincture also we take the totality of the constituents. And the dose usually would be in the drop doses only. Generally, we don't recommend in homeopathy to take just 1 ounce, 2 ounce, something like that, except in some cases where Clark and boric materia medica suggest that to take in large quantities. And they are preferred mostly as a short-acting drugs along with deep-acting curative drugs, not only standalone prescription. So these are some of the facts. And their action, if we see the high dilution, the action of or mode of action of high dilution is not fully completely known. And recent studies have shown that they possess they have some nanoparticles, and also there are some electromagnetic signals coming from that. And basically what we understand is it acts on the dynamic plane and dynamic level, whereas the mother tincture, if we see, they act through the phytoconstituents, and the functional groups of molecules actually go and act at the particular site where that particular remedy has its sphere of action. And it acts at the cellular and tissue level directly. So when we see when we give mother tincture and high dilution single remedy, they both complement each other in certain cases where we need to push the pathology through the cellular and tissue level. We have to give mother tincture, and where the dynamic action is required, in almost all the cases we use dilution. Almost in my case, almost every 100% cases I use the indicated remedy. Then wherever it is required, then the mother tincture is required. And the scope of mother tincture is gross pathological changes, and wherever there is an absence of individualizing or characteristic symptom, there we can use for time being mother tinctures, and then we can take some time to study the case in deep, and we can choose a well selected remedy later on. Then in case of lifestyle disorders, for example, patients would not change their lifestyle in many cases. We suggest to do yoga or dieting in fatty liver or high cholesterol, but many patients could not be able to follow. In such cases, mother tinctures would be much useful. and same metabolic syndrome where fatty liver, as I said, in such cases it is much more useful. And it is actually a supportive remedy therapy, not a curative therapy. Here I'm covering the in two parts. One is the indication of rare medicine, rare mother tinctures, one by one, and then we will see the therapeutics of homeopathic mother tinctures. I mean, for a particular condition, what are the mother tinctures that would be useful. And this is part one. And Abroma radix, basically Abroma radix. Before that, I would like to show a small disclaimer which I have just made it. Is my screen visible once again?
No, sir, not visible. Please restart, sir.
Okay.
He lost the.
Is it better now? Is
No,
it
sir,
visible?
not visible, not visible.
Not at all. Okay. Once again, I'll share it.
Please share it once again.
Yeah. Right. I think it must be visible.
Yes, yes.
Right. This is just about me, that I am a homeopathic practitioner, not a specific school practitioner. So I do practice classical homeopathy where the case warrants, and I do practice clinical homeopathy. I mean, where there is a need, I would not shy away to go to a specific drug along with the indicated, along with the classical homeopathy. Then specific mother tinctures and clinically proven formulations I have been using in my practice. And yes, I use biochemic also. At the end of the day, I practice only homeopathy, nothing else. And my mission is to restore the patient from sick to health, as Dr. Hanneman said, in a most harmless way. So if you expect something from the classical homeopathy, please, I would like to request your pardon that it is not, I'm not the person to speak only on the classical. And these views are my personal views based on my experience, as well as being working with Schwabe. We get a lot of inputs, a lot of feedback from the doctors, and it is not a view of Schwabe. Schwabe as a global organization, we go with the different types of different schools of thoughts. And as I said, this is the content. And Abroma radix. Abroma radix is a drug mainly to regulate the menstrual flow. It is a very good uterine tonic. If you see in herbal therapy, majority of the formulations or majority of the physicians, they use Abroma radix rather than Abroma augusta. More than Abroma augusta. Abroma augusta is also a very good mother tincture or remedy for menstrual irregularities. But this is Abroma radix is more specific, what I have observed. And the indication is dysmenorrhea, leukorrhea as a supportive in cases of infertility, and also it has anti-fertility activity in large doses, but we give in mother tincture form in low dose. It is supportive in infertility cases, and there are researchers which confirm its usefulness in contraction of uterus. I mean, when there is a contraction, when there is a dysmenorrhea because of the contraction, and this remedy would be helpful. And Adonis vernalis is the only mother tincture, I would say, which is useful for hypotension, low blood pressure, rather than high blood pressure. And all other remedies, all other mother tinctures are useful for high blood pressure only, to reduce the blood pressure, like Revolvia serpentina. But this is a remedy which is used in mother tincture for low blood pressure. It is, apart from that, it indicates in low vitality, weak heart, and slow and weak pulse. And it has direct action upon the heart. It pushes the heart rate. It stimulates and pushes the heart rate, so that the heart rate would increase. If it is 40, 45, 50, then it increases to close to normal, 72. And then also the blood pressure. And the indication, basically, if we see the symptoms, vertigo, yes, these are the common symptoms of low blood pressure, we know that. So all those low blood pressure symptoms are indicated by Adonis vernalis. Mellitus farinosa is another rare drug. Of late, in the last 5 to 10 years time, we can see its use has increased. Many doctors know about this particular drug and they use it. It is again a drug for drug used as a uterine tonic and useful in dysmenorrhea, irregular and threatened abortion, and menopausal problems. Here I don't find any. In some cases there are specific indication, like when there is a 3rd month abortion, then this remedy would be useful. But here I don't find any specific periodicity, something like that. In any type of threatened abortion cases, it can be used to prevent, and more suitable to anemic women, and it has shown in researches estrogenic activity. Ammi it has become very popular in the last 15 years for vitiligo and leukoderma, where we have Soralia for vitiligo, which many times it creates reaction in the skin. Ammi doesn't give such kind of reactions. It is a very safe remedy. Only in very rare cases, sometimes if when we ask the patient to apply on leukoderma and exposed to the sunlight, then if the time is for a prolonged period, for 30 minutes or 1 hour, then people get eruptions or rashes. Then in such a case, generally I suggest the patient to hold exposing to the sunlight for some time. Then after 1 week or 10 days, that exposure can be again started, and the period should be maybe around 10-15 minutes would be enough for exposing to the sunlight. And Azadirachta indica is a good detoxifier of the skin for almost every kind of skin problems, be it allergic or infective skin eruptions. It can be used, and it is more suitable in cases of infective skin eruptions rather than allergic skin eruptions. But it is indicated in both the cases. As I have written here, it is useful for boils, ulcers, eczema, and scabies. It is used both internally as well as local application. Bacopa is a good remedy which is used in Indian medicine, both in northern part of India and more in southern part of India, in all the 4 states, Andhra Pradesh, Karnataka, Kerala, and Tamil Nadu, as a brain tonic. In Hindi, it is called as Brahmi, and in Tamil, it is also called as Nir Brahmi also sometimes. There is one more remedy in the name of Brahmi, that is actually in Tamil it is called, Tamil and Malayalam called as Valavan, but that is actually Hydrocotyl asiatica. Both are different, but some confusion is there in the botanical name. In the name, in that Hindi name Brahmi, earlier days, but now it is very clear that Bacopa moneri and Hydrocotyl are different remedies. And yes, it is useful for impaired memory as well as for stimulating the brain function. Many studies have proved that it improves the learning abilities and mental function, overall memory and concentration. And recent studies say that it is useful in anxiety, neurosis as well. It is a good adaptogenic tonic like ginseng. Ginseng is also a very good adaptogenic. Ginseng, Vidania somnifera, both, and this is also known recent days as a good adaptogenic tonic. Cardus marianis is a well-known liver remedy. We all know that, and I don't think much information is required for that. And yes, recent studies have shown its antioxidative, anti-proliferative effects, especially in the hepatic cells. Cassia fistula is another Indian remedy, Indian drug, which is it has a very specific indication. In case of ringworm, along with acidum salicylicum mother solution, I prescribe this as well, Cassia fistula as well. But both are useful in local application, not as internal remedy. Both are local application, and internally it is used as a laxative and as a liver and digestive remedy. And some literature suggests that it is useful for gout and rheumatism. Yes, in Indian medicine also for snake bites. Coleus aromaticus is a very good remedy for respiratory troubles. It is across the country from north to south. Coleus aromaticus has been used in case of cold, cough, respiratory congestion, all those stuff. And in homeopathy also is mother tincture is much useful in such problems. And also another indication, gonorrhea. And in researches it has shown very good antibacterial potential and also disease resistance property. Chelidonium is a well-known liver remedy. It is a well-established drug for centuries, so I don't think much is required. And yes, recent studies have also proved that it is useful in liver cancer as well. But these are preclinical studies. How much it would be useful, that we have to see in clinical aspects. Yes, in clinical cases, I do prescribe this as a supportive therapy along with classical homeopathy, even in case of liver cancer, along with hydrastis mother tincture. Crataegus is a wonderful mother tincture to remove the blockage of the blood vessels, and especially in case of stroke or ischemic heart disease, it is useful, much useful, but as a supportive therapy. Yes, definitely we would not take risk. I generally suggest this, recommend this as a supportive remedy only, and it is especially useful for senile heart. In almost all the patients who are 60 plus or 70 plus who have a weak heart, this mother tincture can be suggested on regular basis. There are many studies which have shown that this remedy is much useful in case of weak heart. Echinacea is also is a well-known remedy in homeopathy. It is not a rare one. It strengthens the immune system. Wherever we find cases with frequent and recurrent cold, cough, or other infection, then we can give Echinacea angustifolia as an immune booster. And there are studies which show that it stimulates the cellular immunity and also the defense mechanism. And also it is useful in blood poisoning and septic condition as a very good detoxifier. Escherichia californica is a rare remedy and it is very good for sleep along with or in addition to Passiflora incarnata. We all know about Passiflora for sleep, but this is another addition which in many cases people come and say that after Passiflora incarnata they don't get required sleep. So in such cases, Escherichia californica can also be added along with that. And there are many studies as well, and apart from that, yes, it is proven to be a remedy for paralysis as well, but I have not used it. It is from the literature. Fraxinus americana is one of the few remedies which are useful for uterine tumor, basically myoma of uterus, and the indications are enlarged uterus, prolapse, and also sub-innovulation, where the uterus goes inside, and also, as I said, uterine tumors. And it is a good uterine tonic along with Abroma radix and Aletris farinosa. Ginkgo biloba, again, it is a famous drug in the last few years, maybe 2 decades, I would say. Before that, there is no much literature about this drug, and there are some studies as well by CCRH Hyderabad unit about the use of this Ginkgo biloba, and there are number of, more than 200 clinical studies conducted with this remedy, Ginkgo biloba, not exactly our homeopathic Ginkgo biloba, but Ginkgo biloba extract, showing that it is very, very effective in case of dementia. So in case of dementia and Alzheimer's disease, this would be the first choice along with the indicated remedy which we may prescribe. It improves the memory and concentration as well. And ginseng is, as I said before, it is a very good adaptogenic tonic. And in case of almost all the stress conditions, this remedy can be given. Stress, anxiety, all those cases it can be given. Then apart from that, it also stimulates the immune system. With Echinacea, this may be given. Ginseng may also be given. but only in case of children, better to avoid ginseng because it is a very good sexual stimulator as well. But not in all the cases. In certain cases, it would be, and in certain doses, high doses, it would be useful as a sexual stimulant. Goteria gaumeri is another, even though it is there in the literature for so long, but it is not well known since recent past. It is a very good remedy for cholesterol. It is an anti-cholesterol remedy. And yes, when we give Goteria gaumeri along with other drugs like curcuma longa or Crataegus, this helps to reduce the cholesterol level along with lifestyle modification, including the diet and exercise. Some yoga would be required, maybe specific yoga for reducing cholesterol or reducing the tummy can be recommended to the patients. Hydrastis canadensis, it acts on the basically on the mucous membrane, and almost in every cancer cases it can be given. And there are studies, I mean way back several decades ago, the first study which was conducted with hydrastis showed it helps to absorb or reduce the tumor cells. So since then its use in tumor, I mean the malignant tumors has also been started in homeopathy, and homeopathic mother tinctures also show that it is useful in cancer. And normally in normal cases also, cold and cough, it would be much useful. And it stimulates the autonomic nervous system and it constricts the blood vessels as well. Hydrocotyl is a very good liver remedy apart from other indications. And yes, it could be one of the top remedies for jaundice, leprosy, gonorrhea, leukorrhea, and it has multi sphere of action. And yes, it will be helpful in case of convulsions as well. Helonias dioica is another rare remedy, and apart from some remedies, one of only a few remedies we have for PCOD, polycystic ovarian syndrome, and it is one among them. And that is a major indication, ovarian cyst and fibroid uterus. And it is also useful in many cases to stimulate the uterus, both uterus and ovary. And yes, in 6 potency, many doctors use this as a anti-diabetic drug, but I haven't used it so far. But it is there are studies also which show that it has anti-hyperglycemic effect. Menispermum is another rare remedy which is useful for depression and migraine. And apart from headache, I haven't used this remedy for other purposes. Muropuma is again another rare remedy for sexual dysfunctions, both in case of impotency and sexual wellness. It is a good remedy, but I haven't in 2-3 cases I have given Muropuma singly, standalone remedy along with the indicated remedy, no other mother tincture, only Muropuma. But when I give with the as a standalone remedy, standalone mother tincture, it doesn't have much effect. But when we give it with other similar mother tinctures like Damiana, Neuferlutia, then it is much used. Okabaka is also again a recently well-known remedy, which is useful for digestive problems. Especially, it is a drug. It is a remedy which is used as a detoxifier of digestive system. So overall, it is useful in flatulence, dyspepsia, and also it helps in gallbladder and liver and pancreas. All these organs are covered. Olibanum is becoming very popular in case of osteoarthritis these days. Even though in Indian system of medicine it has been used for similar conditions for longer period. But in recent past, in the recent 1 or 2 decades, it is well known in case of herbal medicine, especially herbal extract medicine, in the name of Boswellia serrata. If you just Google Boswellia serrata osteoarthritis, there are number of hundreds of studies conducted with this extract, and especially it acts through, there is one particular phytoconstituent called boswellic acid. In that also acetyl keto boswellic acid, which is shortly called as AKBA or ADBA. That is the one which is responsible for its anti-osteoarthritic effect. Pereira breva is well known for renal stone. We all know that, and also it is useful in case of prostatic affections. Passiflora, as I said before, along with Escoltia, it is a wonderful drug for managing the sleep. Phyllanthus neruri, it is well known in southern part of India in the name of Kira Nelli for liver complaints, and it is today it is used in homeopathy as well. Homeopathic mother tincture of Phyllanthus neruri is available, and CCRH, Central Council for Research in Homeopathy, has conducted a study, drug proving as well as clinical verification of this drug. I think in something around in 1980s or something. Then the clinical verification was done later on in 90s. But the indication is same for liver complaints. Prunus spinosa is another hypertensive drug along with Crataegus, Rolfia. This Prunus spinosa also would be useful to reduce the blood pressure. And apart from that, yes, it is also useful for other related conditions like dyspnea, cardiac asthma, and angina pectoris. Not in very critical stage, but in the preliminary stages. It helps in cases of some urinary problems as well, and also headache. Raulfia, we all know that it is for high blood pressure. It is one of the top remedies for high blood pressure. And Sabal cerulata, we all know that it is a very good drug for prostatic problem, prostatic hypertrophy. Recently, its mechanism was also is well established. Actually, well established in case of alopecia. Apart from prostatic problem, recent studies have shown that it is useful in case of alopecia as well. It basically reduces the dihydrotestosterone, which is actually when testosterone converts into dihydrotestosterone, that is actually causing alopecia. So it reduces that. Spartium is one among top 4 hypertensive drugs, I would say. As I said before, Raulfia, Crataegus, Prunus, Spartium. Then the 4th one is Spartium. These 4 together will act as one of the top remedies for hypertension. And in case of Raulfia serpentina doesn't have much effect, then Spartium would be Spartium and Prunus spinosa would be helpful. Crataegus is a bit of, I would say that that is a long-lasting effect. That would be having not immediate effect, but long-lasting effect. Syzygium jambolinum, this is a top remedy for diabetes. We all know that one of the top trio anti-diabetic remedies, and all the indications related to diabetes, it is helpful. And its zinc nanoparticle have shown photocatalysis property as well. So that means that it degrades the dye faster. So people are researching that how that particular activity will be helpful in healthcare sector. Terebinthinae oleum. It is basically made up of turpentine oil. It is a good remedy for joint pain when applied locally. Then apart from that, it is a very good diuretic, and it is useful in urinary complaints. And in case of anasarca ascites, because of its diuretic effect, it reduces the congestion or accumulation of water from the organs, so that the swelling can be reduced. And then because of its same action, anti-diuretic effect, it is good in case of other renal conditions as well. Attica urens is another remedy for gout, along with Berberis vulgaris. Berberis vulgaris is a very good drug for gout, and Attica urens. Both together would make very good anti-gout remedy. Viscum album is another remedy for high blood pressure. Then apart from that, the related conditions, related symptoms, signs like palpitation, increased pulse rate, for all those conditions also it is much helpful. And it is basically where there is a valvular insufficiency, valvular affections, this remedy is more indicated. Vidanya ashwagandha, it is called as Indian ginseng, and as I said that before, it is a very good adaptogenic tonic as well as a good mental tonic, brain tonic. So these are some of the drugs, rare remedies, and then quickly I would go through the part 2, which is therapeutics. Diabetes mellitus, the top 3 trio anti-diabetic remedies are syzygium, gymnema, cephalendra, that we all know already. Apart from that, there are some other mother tinctures which are also useful, like angustifolia, oleum sativum, Azadirachta indica, Caesalpinia bondusilla, Osmum sanctum, which is tulsi, Rus aromatica, and Tinospora cordifolia. These are also very much helpful for diabetes. And hypertension, as I said before, Prunus, spinosa, spartium, revolvia, Crataegus, all these 4 are there. Then apart from that, if we see alphabetically, yes, Boerhaavia diffusa would be helpful to reduce the cardiac congestion so that the high blood pressure can be reduced. And then other remedies are Convallaria majalis, Terminalia arjuna, which is very common in Indian medicine, and Viscum album. These also are helpful in high blood pressure. To improve immunity, I already told you about Echinacea angustifolia. Along with that, Echinacea purpurea, Eleutherococcus, and propolis. These are also useful. This Eleutherococcus is called as Siberian ginseng. It is a Siberian remedy, and there it is the action of ginseng from whatever way people use ginseng in Korea and Vidania somnifera in India, and the same way Eleutherococcus is used in Siberia. And for renal stone, we all know about Berberis vulgaris. Then apart from that, there are few more remedies like asparagus, Ammi visnaga also. Apart from vitiligo, it is a very good drug for renal stone. And Borago officinalis, Cantharis, Carica papaya. Papaya is another drug. I mean, in case of diet also, we can suggest the patient, renal stone patient, to take more papaya fruit. Chimaphila umbellata, Polinsonia canadensis, Hydrangea, Osmum canum, Parera breva, and sesame. Gallstone, it is theoretically, I would say, generally when patient come, I would say that only there is a chance of 5% to remove your gallstone, but maybe the symptoms of your gallstone be managed with some of the homeopathic. And in 3 cases, I have seen Goldo and Berberis vulgaris useful to reduce the gallstone size. And the other remedies which are there in literature are Chelone glabra, Cheonothus virginica, Chelidonium, Dioscorea, and Fabiana imbricata, which is pitchy. For uterine fibroid, along with Fraxinus americana and Helonias diarca, Klapsibassa and Dioscorea villosa also would be helpful, but not directly to reduce the stone, but for arresting the bleeding and managing the pain. For ovarian cyst, apart from Helonias diarca, I said about Apis mellifica, usually that is useful in 3x potency. Then Dioscora villosa would be helpful to reduce the pain. Fraxinus americana, Geranium robertianum, these also would be helpful. Especially geranium is useful to arrest the bleeding. If there is a profuse menorrhea or metorrhagia, then geranium is much useful. Then other remedies include Lithospermum, Lupulus, Taxus baccata. Taxus baccata is specifically for ovarian cancer along with Lupulus. For constipation, Abies nigra, Cascara sagrada, Chelone glabra, Hydrastis, Marubium vulgar. These are the remedies which could be helpful. And in many cases, Hydrastis alone would be helpful, but that would be costly to the patient. And dysmenorrhea, As I said before, Abroma radix is a very good drug for dysmenorrhea. Apart from that, Litris farinosa, Aquilegia vulgaris, Belladonna in 3x potency also is useful. Then other similar remedies are Simicifica, Polosynth, Dioscorea. In majority of the cases, Dioscorea is a wonderful drug. Nephalium polycephalum, Sabal cerulata, Tenacitum vulgare, Tarantula, and Viburnum volpulus would be useful. Diarrhea and dysentery, the top remedy apart from the indicated single remedy, maybe podophyllum, veratrum, arsenax, whatever. Apart from that, I think majority of the cases are managed with the indicated remedy only. I generally don't need to go for mother tincture for diarrhea and dysentery. But if at all is required, it is taking time. Then Holorina would be the top remedy. Then some of other mother tinctures like Okumbaka, Khalifa, Acheranthus, Acorus calamus, Ailanthus, Alstonia, Andrographis, Apicia, Cardus, Benedictus, Emblica, Potentilla, Nux moscata, and Reum. These all are also much useful. Ringworm, as I said before, Acidum salicylicum and Cassia fistula are my frequently used remedies. And here I forgot to mention Acidum salicylicum is also local application, LA. Then apart from that, Cassia fistula and Cassia sophira. I showed you the presentation of a slide of Cassia fistula, but not Cassia sophira. Cassia sophira, what happens in the literature, only Cassia fistula is there. But for some time, Cassia fistula mother tincture was not available since it is a rare. Then I tried using Cassia sophira. I got result from Cassia sophira as well. So that's why recent time I have included this Cassia sophira also in my practice. But Cassia fistula has much more better effect than Cassia sophira. And then Drosera, Iris, Fructissima, Lobelia, and Fleta. These are also much helpful in ringworm. And this is based on the last three are based on the literature. I have not used. It is there in, I think, Blackwood material. And for psoriasis, Acidum salicylic
Doctor, sound is
being automated disorder. Many times, surprisingly and magically, with a single dose, everything is cleared in case of psoriasis. And sometimes, whatever the drug, after doing repetization, all those stuff, patient do not improve. In such cases, I give some of these mother tinctures. Basically, majority of the mother tincture, the very commonly used is cardiospermum and Berberis acidum salicylicum mother solution. Then apart from that, Lucas aspera and Bulleri said before, Amivisnaga, Soralia, Hydrochloride. These three are helpful. And for any type of skin conditions, these are some of the common skin remedies when used in mother tincture. Azadirachta, Berberis acufolium, and apart from that, these are some of the other mother tinctures like Borago officinalis, Cantharis. These days, availability of Cantharis has become very difficult, and in future, way back because of certain regulatory issues. So generally, we don't get authentic Canth India, but we don't want to manufacture mother tincture which such duplicate or identical but not the original Spanish flag. And then apart from that, Clematis erecta, Protic, Fumaria, Hydrocotyl, Voliant, Scrofularia minor, all these are used in case of skin condition. Then platelet count, it is well known. I mean, in vitiligo, I already have spoken. Then for skin conditions, including eczema, dermatitis, this Azadirachta, Berberis acufolium, cardiospermum, these are some of the top mother tinctures. Then apart from that, Other remedies like Cantharis, Burago, Clematis, Croton, Fumaria, Hydropetyl, Oleander, Scrofularia, and Viscum. These are useful. And platelet count, as I said, Carica papaya and Tinospora cordifolia. These are the top remedies. And for hair fall, okay, for hair fall, this is very common. If we see, I think almost every doctor would be getting at least 30% of cases of hair fall. 30% of their cases would be hair fall cases, 30 to even 60-70% sometimes. And Arnica montana is a well-known remedy, mother tincture. Then apart from Arnica montana, Jaborandi is there, and these are top top mother tinctures. We can say that they are useful for hair fall. Then apart from that, acidum salicylicum is useful when there is severe dandruff. Acidum salicylicum is for severe dandruff. Then when there is a mild to moderate dandruff, then Berberis acufolium and cardiospermum would be useful. And since Cantharis good quality mother tincture is not available these days, I am omitting that. And Ceanothus is a very good, again, a very good tonic for hair. And then Cochlearia is another remedy for dandruff. And then in recent times, two remedies, Sabalcerulata and Thuja occidentalis. These two are known, well established for androgenic alopecia, androgenicus alopecia. And the reason is we know that it acts on the prostate. I mean, the enlargement of prostate. The same mechanism applies to androgenic alopecia also, with slight modification. Then we have only two remedies, remedies in mother tincture for premature gray hair. One is Salvia officinalis, second one is Jaborandi. And then internally Acidum phosphoricum is there. And as I said, premature gray hair, Jaborandi, Salvia officinalis. Yes, Vinca minor is also there. I have not used so far, but some literature suggests that Vinca minor also is useful in premature gray hair. Dandruff, as I said, already I have told you, Acidum salicylicum, Cochlearia, Cantharis, cardiospermum, Berberis acufolium. And for dressing and wound healing, we all know about Calendula, Echinacea. Then apart from that, there are few more which are useful in case of dressing and wound healing. And for liver affection, there are ample of remedies which are useful. Like apart from Chelidonium, Cardus marianus, Hydrastis, there are few more like Andrographis, Berberis vulgaris, Cassiophystrula, Chelidonium glabra. These are also useful. And for alcoholism, Quercus robur, Angelica officinalis, Avena sativa, and Brassica oleracea. These are some of the commonly used remedies. And for spleen, I generally use my first choice of remedies would be Ceanothus americana and Ceanothus virginia. Then apart from that, there are few more also. I'll share these remedies to you. Maybe later on it can be shared to the participants. Since time is less, I'm a little bit moving fast. Pancreas affections, Candurongo, Okobaka, and Iris versicolors. These are the three specific mother tinctures useful for these conditions. Hemorrhoids, I think we all know there are remedies like hemamylase, Aesculus hypocastrinum, Colinsenia, these drugs. Then apart from that, peony also is useful to ease the stool, and Retania, millefolium, these are also useful. Uterine tonic, already I told, Abroma, radix, Alectris farinosa, Abroma, Augusta, all these. Then hyperlipidemia, as I told in the before in the beginning, Goteria, Gomeri, Crataegus, Phytolacca, and Curcuma laga. These are the top mother tinctures useful. Thank you so much for your patient listening. If you are used, even though it gradually reduces the blood pressure, and the prolonged usage of Rauwolfia, especially the reserpine, the active component of Rauwolfia, it has so many side effects. But there is a study which conducted comparing reserpine and Rauwolfia mother tincture, which showed that Rauwolfia mother tincture doesn't have side effect, but whereas reserpine shows a lot of side effects. So, but even though your suggestion is very well valid, and prolonged usage should be avoided unless otherwise in case of emergency case.
Doctor, impotency. It will cause impotency. Raulfia will cause impotency also.
That is true. That is true for all antihypertensive drugs. Wherever we try to reduce the blood pressure, then it reduces the blood pressure of the penis also. So ED, erectile dysfunction, is very common in such cases where they use it. But they are all that is used for a prolonged period, longer duration.